Hello everyone, I am Dr. Meenakshi Gupta from the Conceptual Pharmacology channel. Today I have come up with one of the important question which is very commonly asked in the pharmacology paper. Why aspirin in low dose is used as an antiplatelet drug. So let's get started with the answer of this question. So aspirin, it is a non-steroidal anti-inflammatory drug. So this is the abbreviation of the we also say it is a NSAID. So how this aspirin or this NSAID it is going to act? It is going to inhibit the enzyme cyclooxygenase, or we can say COX. It is going to inhibit this enzyme irreversibly. Now what is the action of this COX? This enzyme it is present almost in all the tissue. It helps in the synthesis of eicosanoids, especially the prostaglandins, and how it is going to cause a synthesis. First normal, how it is going to cause the synthesis of this eicosanoids. So this COX it is going to convert arachidonic acid into various prostaglandins, and from where this arachidonic acid it comes from the membrane phospholipid. Now cyclooxygenase enzyme it is going to cause this action. Now further synthesis of this, and these two they are G2 and H2, they are the unstable compound. So for the synthesis of eicosanoid it depends upon the tissue and it depends upon the enzyme which is present in the that particular tissue. Like if there's a isomerases, very commonly we know isomerases, they are going to cause the synthesis of very commonly prostaglandins PGE and PGF2 alpha, whereas in the platelet it is going to cause the synthesis of thromboxane A2 with the help of enzyme thromboxane synthase. So this helps in the synthesis of thromboxane A2 in the platelet. Whereas in the vascular endothelium there is a prostacyclin synthase. It helps in the synthesis of prostacyclin. So this is in the platelet. Right here, this is in the platelet, and here this action in the vascular endothelium. So I already told the COX enzyme it is present almost in all the tissue. So this is a platelet thromboxane A2, that is a platelet aggregator, and this is a platelet anti-aggregatory prostacyclin. Now if you are going to give the aspirin, which is a non-steroidal anti-inflammatory drug, it is going to inhibit this enzyme. Once this is inhibited, cyclooxygenase, then what will happen? This whole thing it is not formed. ना तो ये prostaglandins बनेंगे, ना आपके ये thromboxane A2 बनेगा, आपका ये भी नहीं बनेगा और आपका ये भी नहीं बनेगा. So usually these two they are in a balance, platelet aggregation or anti-aggregatory. So they are in a balance. So what usually the students they write in a low dose. So question is aspirin in a low dose. So low dose का aspirin in a low dose में क्या है? So in a low dose the students they usually write it is going to inhibit this. ये वाला inhibit हो जाएगा, this one, ठीक है, और ये रहेगा in a low dose. Right, partly it is right, but why in a low dose? You have to explain it. In a low dose what is, and in a high dose they say कि both the enzyme they are inhibited, thromboxane synthase and prostacyclin synthase in the which is present in the vascular endothelium, दोनों के दोनों इनहिबिट हो जाएंगे, ना thromboxane A2 बनेगा ना prostacyclin बनेगा. But yes, definitely 35 to 40% marks you will be getting. But here the still the answer it is not complete. The answer is like in a low dose. What is especially in a low dose? Why it is going to? You have to explain why in low dose it is going to inhibit only this. वो सिर्फ इसको ही क्यों इनहिबिट कर रहा है, ये इसको ही क्यों इनहिबिट कर रहा है, थ्रोम्बेक्सिन A2 को, प्रोस्टासाइक्लिन को ये क्यों नहीं कर रहा, why not this? This is the once you explain this point, then your answer will be complete. Now the next section I will be explaining why it is the at a low dose the net effect is inhibition of this thromboxane A2. Okay. Now aspirin, it is a COX inhibitor. It is going to inhibit it irreversibly. And how it is going to inhibit it? It is going to cause the acetylation. इसकी बेटा acetylation कर देता है. It is going to cause the acetylation of this enzyme and going to inhibit it irreversibly. Now what happens? This thromboxane, it is synthesized from where? From the platelet. Now once you give the aspirin in low dose, this platelet, they are exposed to aspirin in the portal circulation itself. ठीक है, जो प्लेटलेट है वो पोर्टल सर्कुलेशन में ही एस्प्रिन से एक्सपोज हो जाते हैं. सो एसिटाइलेशन ऑफ द कॉक्स एंजाइम इन द प्लेटलेट विल बी inhibited in the portal circulation itself. So acetylation हो जाएगी COX enzyme की which is present in the platelet in the portal circulation itself. अब आपने क्या किया? You have given a low dose. ठीक है, आपने लो डोज दी है. सो ये कहाँ पे इसमें प्लेटलेट में क्या हो गया? Acetylation will happen in the portal circulation. जब पोर्टल सर्कुलेशन में हो गया तो लो डोज में क्या हो गया? इन अ लो डोज a very less amount will come into the systemic circulation. Systemic circulation में बहुत ही कम आती है. So what will happen? So it is not able to inhibit. चलो अगर ये कर भी देती, let's say if it inhibits this prostacyclin which is synthesized from the vascular endothelium. Now the second point in a favor of this की net effect in low dose, it is going to inhibit only the synthesis of thromboxane A2, not the prostacyclin. So second point is now platelet. They do not, so already as you all know, platelet, they do not have nuclei. They do not have nuclei. So what will happen if they do not have nuclei? So that means they are not able to synthesize the new enzyme. उसमें aspirin ने क्या किया? It is going to inhibit this enzyme irreversibly. So for the new enzyme, what we need? We need a new set of the platelet. So new enzyme and platelet की कितनी है? So till the new platelet comes, this enzyme it is inhibited. On the other hand, this vascular endothelium, they have nuclei. अगर ये inhibit भी हो जाता थोड़ा बहुत, तो vascular endothelium as they have the nuclei, they can synthesize this prostacyclin. So ultimately, in a low dose, ये वाला जो आपका point है, in a low dose, aspirin, it acts as an antiplatelet drug by inhibiting the thromboxane A2 but not prostacyclin. So already I have told you. So what happens in a low dose? In a low dose, it is going to acetylate this COX enzyme in the portal circulation itself. So platelet, they get exposed in the portal circulation. So very less amount will reach into the systemic circulation. So where it is going to inhibit the prostacyclin but not up to the mark, even if it is going to block, but the vascular endothelium cell, they have a nuclei, so they are going to synthesize the new prostacyclin. On the other hand, platelets, they do not have the nuclei, so they are going to inhibit this one, thromboxane. So net effect of aspirin in low dose, it is going to inhibit the thromboxane A2 and sparing the prostacyclin. Hope it is clear. So you can write this, the question which comes aspirin in a low dose as an antiplatelet drug. If you like my video, kindly subscribe my video and put up your important suggestion in the comment box.